Hi, good evening, good afternoon, good evening, everyone. Thank you for joining another episode of Ask the Pediatricians Live. So, today on ATP Live, we will be having our doctor, a general practitioner, Dr. Tochi. Dr. Tochi, you're welcome to ATP Live today. We're happy to have you. And
Thank you.
before we go on, please, if you are here, just drop a comment, and I'll spend the next 15 next seconds sharing the video on our Facebook group and hosting a watch party. So if you would like to host a watch party on your page, please go ahead and do same. If you would like to hold a watch party on your page, please go ahead and do same. Okay. Um, I'll be sharing on our Facebook group now. Please invite your friends, share this video. You're welcome. So please drop a comment if you are here live. Tell us something. Let's know that you're watching. Esther Chooks, thank you for joining. Thank you for joining. Today is a beautiful experience where we have our general practitioner, Dr. Tochi Alex Madu. So she will be here to answer all your questions. We've been doing this for the past 3 weeks. We've had guests. We've had Dr. Rotimi at a time. I mean, 2 times. We had Dr. Rena the last episode, and today we have Dr. Tochi. So please, let's start asking our questions. Adogu Chinelo Pascaline, you are welcome. Please join us. Invite your friends, and as we share this, okay? I'm going to host the watch party. So if you're going to be asking questions on, hi, Magdalene Samuel, good to have you. If you'll be asking questions, if you're watching we had to host the watch party, Dr. Rena the last, you're going to be asking questions. Am I echoing or something? It looks like something is not going on.
Sorry, I think it was me. Yeah, it has corrected, right? It was me.
I think so. Dr. Tochi, can you hear me clearly?
Sorry. I can.
You can. Okay. Thank God. So Magdalene Samuel, hello. So please share, invite your friends. I'm still trying to share on our group. So for the next 30 seconds, I will be sharing on our group. And I would like that you also share, invite your friends, and host watch parties if you would like to. So once I host the watch party, then we would start officially. But like I said, you can begin to ask your questions already. Okay, so Dr. Tochi, how are you today?
I'm good. How are you?
Thank you for joining in. So what's the latest before we get
Thank
questions?
you.
Is there anything new that you want to share with us before we begin to get questions on the show? Oh, we already have one question. So if we have some time, I would ask you this question I just asked. But let's go on with the questions we
Okay.
have on
Okay, no
chat
problem.
room. Princess Titi Lokbe is asking, she says, what do you advise on the child that doesn't want to eat? He shows up immediately, you give him food. So she wants to know what your advice would be for a child who does not like to eat.
Okay, thank you. Thank you for the question. So it would be good to give us the age of your child. Maybe subsequently, other people that want to answer, just give us the age of your child because it may affect the answer. So for your child that doesn't want to eat, well, keep him. It depends on what you are giving the child. I want to assume that this child is less than 1 year. It's an assumption because you didn't give us the age of the child. So if I'm right, just keep introducing different like variety of foods to the child and try the food in these ways. Does the child vomit just after eating.
Okay, Dr. Tochi, there's an
vomit
update to the question.
like ordinary.
She has said that the child is 9 months old.
Okay. Okay, so my assumption is in order. Okay, so I'll say keep introducing different types of food to the child, vary the child's diet, make mealtime fun time for the child. Does this child vomit just a particular type of food like cereals or pap, or does he vomit even adult foods, that you offer? So vary it and watch this child. If the vomiting persists, especially if it's not just only after food, you may need to see your doctor. But if this is just related with food, it's possible that the child doesn't like that food or was not in the mood at that point, was not ready at that point, and all that. So you need to just adjust meal times and what you offer the child. But just keep trying, keep giving the child.
Okay, thank you so much, Dr. Tochi, for that. Okay, so ask your questions.
You.
Don't forget that you are live on Ask the Pediatricians, and like I said earlier, today we have our general practitioner in the house, so you are at liberty to ask questions about your own self, your child, your mom, your aunt, anybody. Dr. Tochi is willing to respond to all of those questions. Okay, so I think she's giving more updates. She said, he permits anything you offer. I think Dr. Tochi has answered your question. I think you should just, you may need to take the child to the hospital if you've done everything that you need to do.
Okay, so let me just address her too. So try different forms. Does he vomit rice, for example, pureed or no pureed? You understand? Like try semi-solids at 9 months. You can also give soft foods, even if it's not picked or blended. Then, like Dr. Very also said, if it continues, please see your doctor, especially to ensure that the child's development is in order.
Okay, thank you, Dr. Tochi. Kolawole Shakira is asking, is there any food that you advise for a child that okay, maybe a child just has blood transfusion from jaundice, so she wants to know if there's any specific kind of food. Okay. And she says a child is, how old is this child? Okay, please, ladies, gentlemen, everyone on this program, when you ask your questions, we really like to have the age of the child you're asking about, because like Dr. Tochi said earlier, the answers to your questions may vary just because of the child's age. So you want to please include your child's age as you ask your questions. Thank you. All right, so for Kolawole, your question is up. I hope you give us the age of your child. But Dr. Tochi, please, you can give the response.
Okay, Kolawole, so exchange blood transfusion done in severe cases of neonatal jaundice. When the bilirubin level is very high, to prevent what we call kernicterus, the bilirubin entering the brain and causing irreversible brain damage to the child. We usually do what we call exchange blood transfusion, where we take out the baby blood in bits and transfuse blood to the baby. So if a child has undergone exchange blood transfusion, there is no special diet, there's no special food to give or not to give. The child follows general recommendations of that age group, which is exclusive breastfeeding for the first 6 months of life. So there is no special foods you need to give after that. Just for your pediatrician or whoever did the transfusion, because we need to monitor the child's bilirubin level, needs to be monitored to be sure that everything is out of danger zone. And then, but food wise, there is no special diet, nothing to give, nothing to avoid, just continue exclusive breastfeeding.
All right, thank you so much, Dr. Tochi, for that. Okay, I think I missed the question from Yeti Agdekube, and she just gave us her child's age. She says her child is 15 months. Hello, doctor, what can I do to soften poop? The child is 15 months.
Okay, so the poop of a 15-month-old, okay. Okay, so Yeti, increase fluid. Make sure this child takes water, regularly enough, and then fruits too. Like this child can be offered orange juice or other forms of fruit, pureed, or whole. Do that, and then just increase the child's fluid intake. Yeah.
Okay, thank you. Olaide It says, what do you advise on a 9-year-old child who gets frequently constipated with leg cramps and lower abdominal pain? She only takes water when I remind her, though, and I can't always be available to remind her.
Okay. Well, it's water is very important. Like for a child, baby, adults, that cannot be overestimated. You could try putting water in bottles for her. You know, maybe you can put 3 bottles of water, okay, or maybe sachet water. Just bring out a portion kind of in the morning and make sure that before the end of the day she finishes that. You know, just try that. And then she has leg cramps and low abdominal pain. You may
And
need to
lower
see your
abdominal
doctor
pain.
for this, especially the low abdominal pain. Yes, especially low abdominal pain. We don't know what part, of her tummy is paining her. We don't know if this pain is just associated with the constipation or is there at all times. We also don't know. Okay, She's 9 years old. Okay, so just for the pain, because we're not sure of the frequency, we're not sure what brings it on and off, or the character of the pain. You may need to see your doctor for that. But for the constipation, just the same general rule: increase your fluid intake, fruits, and all that. That should work.
All right. Thank you so much, Dr. Tochi. Olaide, you got that. Increase your fluid intake, increase fruits for the child and vegetables, and see your doctors for the other complaints. Thank you so much, Dr.
Yeah.
Tochi. Adogu is asking, is it possible for a child to have malaria without fever?
Okay, thank you for the question. So fever is a very common, one of the common symptoms of malaria, but it is actually possible for a child to have malaria without fever. Like we said, the age of the child
It
matters.
says the
Sometimes
baby is
the
4 months
child may
old.
not have fever, but may be very fussy.
She
Okay,
has
the child may be fussy, like irritable. It may be a sign, and all that. But definitively, for you to be sure that this child has malaria, you need to take to a hospital and run a test for her, because all fussiness or all fever is still not malaria. You understand? There are several causes of that. Malaria is one of it, especially in Nigeria. So we need to be sure, but it is possible that the child may not present classically with fever, still have malaria.
Okay, thank you so much. I'm trying to get your question, Paula Wale. You're giving us an update. He's 1 year old, but no side effects. He's walking now, saying "mama" and everything. Let me go back to this question. Okay,
Okay,
okay. She's
yes,
giving us an
yes.
update. The person who asked about jaundice and asking if there's any kind of food that you need to give to the child, if there's any recommendation.
Oh, okay. Okay, then your child is fine. Okay, 1 year old. Wow, okay. So fine. No special diet to avoid or not to avoid. Just yes. Just give family food at 1 year and continue what you're doing.
Okay.
Yes.
So let me just quickly give this update for those of us watching. Take your time to ask your questions. I mean, if you ask
Okay.
us questions without the child's age, and then you now have to update that question, it gets a bit confusing. So you want to take your time to ask the questions. Your child, what you're asking, please include the child's age, and that'd be fine. One Dairo, for example, you have said child who doesn't eat meat, 8 years. I'm not sure what that means, but I don't know if Dr. Tochi can make sense of that. But I'm not sure.
Okay, maybe she just worried that her child does not eat meat at 8 years old.
Yes.
That's what I understand from it.
Yes.
Okay, so meat is a very good source of protein, and at that age, the child requires protein. Well, I would say, have you tried different forms of meat, like beef, goat meat, chicken? And if you've done this and the child has refused all, and the child is already 8 years, well, there is nothing much you can do. Just go to other forms of protein, other sources of protein like eggs and milk, beans, and other legumes. If it's also possible for you to like vary the meats, meatballs or strips of chicken. If you can do that, if you like experimenting in the kitchen, you can do that. But if you can't, then it's okay. The child is 8 years, it's fine. Give eggs, give fish, give milk, give beans or other legumes. That's okay.
Right. Thank you so much, Dr. Tochi. So, Gallant got the answer to your question. I think that's really exhaustive. Yeti, you're welcome. You're welcome. Ezebido is asking, my 4-month baby is purging. Please, what could be the cause and solution?
Okay, so 4 months purging. Okay, so we would want to know if this child is on exclusive breastfeeding. We also want to know what exactly you mean by purging. How often does this child wet his diaper? And then is it really watery? Like, does it soak? Does it seep into the diaper? So if yes to all this, like if it's really diarrhea, watery stool, there could be different causes. One, the most important cause is improper hygiene. At that age, when you're not taking care, kind of, at these kids have already started putting hand to mouth and all that. So we usually have parents to be very, very watchful and vigilant. Keep your surroundings clean. Wash your hands with soap and water after each diaper change and all that. So one of the causes is just infection the child picks from around. And then what the child is eating. If the child is not exclusively bread, how are you sterilizing your bottles or cups or stuff you're using to feed the child and all that? So the solution, what you can do is to give this child, replenish the fluid that is losing. Give ORS and zinc to this child.
All
Pelus
right.
too, give ORS. Pelus will give ORS. But if this persists, and especially if associated with vomiting, please see your pediatrician.
Thank you so
Yes.
much, Dr. Tochi. That was exhaustive. Good evening to the
Thank
person who
you.
just said good evening. Yes. So good evening all. Indo is asking, please, my 8-year-old daughter has recurrent boils
Okay.
on her face. Do I have to go to the hospital?
Okay, so 8-year-old recurrent boils. Okay, let's be sure that it's not pimples, right? Let's be sure that we've established that it's just boils. It's boils, because at 8-year-old, this is pre-puberty. Some 8-year-olds are starting to, get into pubertal age, and then with the increase in hormones and all that, they may get acne, what we call pimples. So if it's acne, there is nothing to worry about. It's just developmental. Then if it's boils, pus filled boils, then you may also need to watch her hygiene and all that, and make sure that she's also eating well and balanced diet, because when your immunity is not really so strong, then your body cannot fight off things that come into it, and then you can get that. Then if it persists, yes, it's enough to go to the hospital to see your doctor for it.
Right. Thank you so much, Dr. Tochi. Dr. Gbemsala, good evening, ma. Good evening. She's saying hello to us, Dr. Tochi. Okay.
Good
So
evening,
Olaide,
ma.
okay. Olaide I think she's giving us a follow-up to our question. Thanks, doctor. For the 9-year-old child with leg cramps and lower
Okay.
abdominal pain, only comes with the constipation. Once she stools, she doesn't complain again about the pain
Okay.
and cramps. She stooled yesterday, Sunday, and today she's crying from the above symptoms. She says she can't poo.
Okay. Okay. Please, I will advise you take this out to the hospital, especially if this symptom has persisted for a while. Please take her for review. Take her to the hospital. Yes.
Right. Olaide, you got that. So Samuel is saying, hi, doctor, good evening. I am a nursing mom and I drink Lipton with enough milk. Is there any effect on my child? And that's one question. The next question is, okay, let's take the first question. She's a nursing mom, she takes Lipton and she wants to know if it has any effect on the child.
No, that's okay. It's fine. No effect on your child. No untoward effect on your child. It's okay.
Okay. So she says, I have catarrh. Which drug can I take that wouldn't affect my baby or breast milk?
Okay. So I think it depends on the weather there. And then this catarrh, is it just catarrh? Is there cough? Is there fever and all that? So if the catarrh continues, you may just need to see your doctor. And then be sure that things that precipitate it, like cold or insecticide or other things that may precipitate this catarrh, you stay away from them. But medications that are safe for you that will not affect your baby that you can take. So just be sure of what you're treating, and I don't think I would want to tell you what to take here. Just review with your doctor, and yeah.
Right. Okay. So SM Princess is saying, what form of family planning do you advise with less side effects?
Okay. So this family planning question keeps recurring. The thing is that there is no one size fits all family planning method. Family planning is individualized. It depends on each patient. It depends on you. What works for one person may not work for the other. It's very important to know your comorbidities. If the person is hypertensive, the person is obese, all those things would inform the choice of family planning. So it's better you see your family physician or family planning practitioner, and by the time you discuss, you'll be able to pick one. But there is no one, like there is no one best kind of. So it depends on you. It depends on other comorbidities a patient may present with.
Right. Okay. Thank you so much, Dr. Tochi. You got that, Princess. Samuel is asking, what fruits should I avoid as a nursing mom?
No fruit as a nursing mom. Fruits are what we advise you take. Fruits are what we advise you take. So please go ahead and take your fruits. There is no fruits that you should avoid as a nursing mom. They are very healthy, natural sources of vitamins and minerals. So go ahead and take fruits as you want. Yes.
Okay, so let me move on to the watch party now. I can see a question there. Christiana Toby is asking, how many hours can breast milk last without a refrigerator?
Okay, so at room temperature, breast milk can stay for about 6 hours without refrigeration. So you can, if you express it 6 hours after, if you've not used it, you should discard it. And it's also advised you express in little quantities per time. Like express, what I mean is that if you're using the cup or the bottle or whatever you're using to express, just make sure that the child finishes each bottle at a time. If you want to express 100 mils, for example, and that 100 mils, this is just an example, the child should take it 3 times. Make sure you use 3 bottles and express 30 mils in each, if you understand what I mean, so that the child consumes the 30 mils at once. Because if you do the 100 mils and the child doesn't finish it, please discard. But it can stay for 6 hours outside the refrigerator at room temperature.
That's exhaustive. Thank you so much, Dr. Tochi. Thank you, Maz. Okay, that's from Indo. She's saying thank you. And Princess is also saying thank you for your job. Well done. My first child, Kolawole is asking again, my first child has jaundice at birth. Hope my second child would not have it.
Okay, so there are several causes of neonatal jaundice. It depends on the cause. Okay, so one of the causes of neonatal jaundice is what we call blood group incompatibility. It depends on, sometimes your blood group and your baby's blood group may not be compatible, and that could cause jaundice. Sepsis is a cause of jaundice. Infection, what we call infection. There are some, okay, also prematurity. Like if your baby was preterm, maybe your first baby was preterm and your second baby is not, so it's not likely your second baby will get it. There are some congenital, like there are some enzymes that a child may not have, at birth. Those ones are kind of rare, but they're also causes of jaundice. So it all depends on the cause of jaundice. It's not a rule or a law that if one child has it, the other child must have it. Depends on the cause of the jaundice.
Right.
So just follow up your second pregnancy closely, and yes, and when you give birth, follow up with your doctor.
Right. Okay. Thank you so much, Dr. Tochi. Kolawole, we wish you the best as you carry your second pregnancy, and we hope not. Okay, so we have another question from the watch party, and I'll just take that. Hello, Doc. My 19-month-old son had seizures in February when he had a fall and hit his head. We have done ECG and also brain scan, but results shows nothing. He has been placed on Epilim and phenobarbital. He do have up to 20 episodes in a day. Please, what more can I do?
Okay. So, okay, he had up to 20 episodes of the seizures a day, right? If I got that right.
Yes, up to 20 episodes, yes.
Okay, and that's a lot. So I would advise that you follow up closely with your pediatrician. I want to believe that is a neurologist, a pediatric neurologist that is seeing your child. The child will have to be on anti-seizure drugs for a while, and you just need to follow up the prescription. You need to give the drug according to prescription. Sorry. So you just need to follow up. There is nothing much you can do on your own outside the hospital, your doctor's setting. There's nothing you can do. So just follow up. There are drugs to give while seizing, and then to prevent seizures or to reduce the frequency of the seizures. So you just need to follow up that. But don't do all the whole traditional practice of palm kernel oil, especially when teething, putting stuff in the when seizing, putting spoon or stuff in the mouth, yes, or in the mouth while the seizure is on. Please don't do all that. Don't cover the skin with oil or don't do all that. You've already identified the possible cause of the seizure, which is possibly the fall the child had. So just follow up closely. If you think the frequency of the seizure is increasing, please review with your neurologist. They may need to adjust the drug or adjust the dosage of the drug. Just follow up closely with your child.
Right. Thank you so much.
Your doctor, yeah.
Okay, so Christiana, you've asked this question and we've responded. So no need asking again. You may want to watch the replay, and Dr. Tochi is taking your question. We need to take more questions that are coming in. Monsura Toluwakem is asking, hi, doctor. I'm a nursing mom and I want to go on a diet. I want to know if it's going to have any effect on my baby. My baby is 7 months now.
Okay. Hi, Monsura. So, you want to go on dieting? Well, generally, I just want to believe that because you just gave birth or you gave birth 7 months ago, you want to lose weight, right? Okay. So, as long as what you're doing is healthy, then it's okay. So we just don't do any crash program. Like, don't go and start starving yourself because you want to lose 20 kg in a month. That's not really sustainable. So what you should do, just reduce your portion, the portion of your meal or the meal you eat per time. If you used to eat 2 cups of garri before, you may need to start taking 3/4 cup or half cup with lots of vegetables gradually, and then increase your water intake, stop carbonated drinks, and then add exercises to your routine. For your baby should have started complementary feeding at 6 months. And even though at 7 months, some of them are still choosy and picky and all that, but as long as what you're doing is healthy, it shouldn't have an effect on your baby, because you will still be breastfeeding at 7 months. So just go about it the healthy way and you should be fine.
All right, thank you, doctor. SM Princess is saying, my daughter is 8 years old and her breathing is kind of noisy. When she breathes like someone who has been exhausted. What can she do?
Okay, so has she really been exhausted? Is she very playful, or is this her breathing like at rest? If it is, and does this happen every time or periodically, like maybe when the weather changes, or if this is just her baseline type of breathing that you feel she has this noisy breathing, you may need to take her to the hospital so that you can listen to her chest, be sure that everything is clear. But if it's periodic, maybe some form of allergy, that something is bringing it up, or something she's using and all that. But just to be sure, you can take her to the hospital to be reviewed.
Right. Okay. So, Princess, you just got your answer now.
Sorry, I just want to add. Sorry,
okay.
I just wanted to add to that question too. If she's also on the big side, her weight also is important. If she's on the big side, you may also notice that she breathes fast most times. So that's also
okay.
I just wanted to add that.
Thank you for that addition. Okay, so we have a question from Ali Danjuma. Please, what can you say about my 6-month-old baby who has a big navel?
Okay, so we call that umbilical hernia. For some children, or for most children, it's usually nothing to worry about. It's nothing to worry about as long as the child is not having maybe stomach pain intermittently and all that. It's nothing to worry about. Sometimes as they grow, it regresses in size, like when they are growing, and when you compare it with their size as they are growing, you see that it's smaller. At other times, some people grow up with it and it's nothing. So if it's not disturbing your child, if your child doesn't have pain from that, then please leave the child.
All right.
If however it is you feel is disturbing, maybe intermittently child wriggles or has pain there, you may need to see your doctor. But if not, it's kind of normal. It's not a thing to worry about.
All right. Thank you so much, Dr. Tochi. That just reminded me of myself when I was a lot younger, when I was a little girl. I knew I had big nipple, but
Oh,
now it's not anywhere again. And I'm sure
okay.
nothing was done to me at the time.
So you have your practical example. You know.
Thank you.
Okay.
Okay, you're welcome, Monsurat. Thank you. We're here to serve you. Tayo Bidmos is saying, good evening. My name is Tayo Bidmos. I have a child of 3 years old who's diagnosed with jaundice at birth. She's here to talk.
Okay, so at 3 years, even though you didn't give us details, but I want to assume that yet to talk is that the child doesn't say any word at all. Because at 3 years, the child should be saying at least 3 word sentences like I want cup, stuff like that, 3 word sentences. If this child is not talking at all, then we should worry. And the jaundice at birth is significant, especially if this jaundice was severe and probably was not treated on time. Because when jaundice is severe, there is a risk of the bilirubin traveling to the brain and it causes irreversible brain damage. The first question someone asked about exchange blood transfusion, that's what we try to avoid. When we do phototherapy, when we do exchange, we do not want it to get to that stage, because when it gets to that stage, the damage is usually irreversible. So I would advise you take your child to see a pediatrician. We also want to know other developmental milestones. The child met other milestones. Is this child walking at 3 years, or is it just the speech you're worried about? So I think you should take your child to a pediatric neurologist or a developmental pediatrician for like a holistic review, and then you may be referred to for speech therapy, but just see a neurologist. Thank you.
Okay. All right. Thank you so much, Dr. Tochi. Akinton, the watch party, is asking, please, my son of 1 year, 1 month, do vomit after eating complementary foods. He only takes pap mixed with milk. What can I do?
Okay. Okay, so I want to understand that he doesn't vomit pap mixed with milk, right?
That's what it looks like. But Akinto, you want to just update your question to tell us what exactly you mean, though it looks to us like it only
Okay.
pap without issues. But if it would be
He
good,
vomits something and then only accept yes.
yes. So
Okay.
she hasn't updated, but you may
Maybe
just
we'll just wait for that update.
Okay, all right.
Okay. So if you want me to just address what I
No,
understand?
I think we should wait for the updates. I think that will make more sense so that you are able to give her the response. So Akinto Titilayo Kwemisire, we've taken your question. However, we need you to update us. Let's know. Are you saying that the child takes pap and milk without throwing up, or the child throws up everything? So please question and we'll come back to it. Let's take another question from the watch party. Christiana Toby is asking, I gave birth last week Saturday, and she weighed 4.2 kg at birth. She was later placed on phototherapy because she was having reactions. Her eyes were yellowish, but wasn't like that when I gave birth to her. We were later discharged after the reaction stopped, but her eyes still not clear enough. Like when I gave birth to her, what can I do still? Do you want me to take that
Okay,
question
so
again?
and what your child has, congratulations. Sorry?
Are you okay with the question? Is it clear enough?
Oh yes, it is. Yes, it
Right.
is.
Okay.
So congratulations, mom, on your delivery, safe delivery. So what your child has is jaundice. It's not necessarily a reaction. It's not necessarily a reaction. If you joined earlier, you must have heard when I said some of the possible causes of jaundice. So I want to believe that usually when a child has jaundice, it doesn't usually appear on the first day of life. It usually appears like on the second or third day of life. So we usually check the bilirubin level. Then depend on the level, we can now do what we call phototherapy, which should be the light your baby was placed on. After phototherapy, we should actually recheck the bilirubin level. So it should come down to a safe level, and then eyes may not clear immediately. But if the bilirubin has been rechecked and it's at a safe level and you've been discharged home, I want to believe that you're also giving follow-up appointments, then there is no cause to worry. The eye will not really turn white immediately. It may take some days before it clears off completely. But if the bilirubin level in the blood has already gone down, then there is no cause for worry.
Right. Okay. Thank you, Dr. Tochi. So I'll come back to this the live video. Please, if you are watching this program on the Watch Party, do well to just come to the Ask the Pediatricians page to watch the live video and then drop your questions, because we'll see that quickly. However, if you still are on the Watch Party and you drop your questions there, I'll still go there to get your questions. I just wanted you to know, if we don't respond to your question in time, that means your question is on the Watch Party. Okay, so let's take Augustina's question, Ortega. She says, my baby is 5 months now, but whenever he sucks, he pulls. He's on EBF. What's the cause?
Okay, so at 5 months, EBF, okay, so I wouldn't really worry about that, especially if the poo is like normal. It's not watery, it's not a poo that completely seeps into the diaper. Exclusively breastfed children could do that. At some points, you can even notice that it's either they are pooing too much, or they are, by our own standard, or they are pooing too little. Like they could stay for 3 days without pooing, yes, and it's completely normal. So as long as the poo it's not watery, as long as the poo the consistency is normal, then there's nothing to worry about. Continue your exclusive breastfeeding and just eat healthy yourself. So there's nothing to worry about.
Okay, thank you, Augustina. I'm sure you got that right. Olani Pekun is asking, good evening, ma. Please, what could cause skin discoloration at the back neck of a 5 months baby? I noticed since 1 month, it's pink, little circle, like fresh wound.
Fresh wound is like sore, it's not like skin discoloration.
Not coloration, okay.
Okay, so yes, okay, so this is skin rash, and there are several causes. 5 months, and that means it's been on for 4 months now, because say you noticed it at 1 month. Okay, well, I would advise you take your child to see a doctor, so that the doctor will physically examine this discoloration, because here it says it's okay, the skin discoloration at the back of the neck. Okay, just I advise you see a doctor, and I don't know if you've applied some things so far, and that haven't worked. See a doctor. Rashes are best seen, when you see it, you're sure of what it is, because there are several causes of rashes. So it's better you see it. It's better a doctor sees it physically. Yes.
Okay, so let me go back to the Watch Party. I think, Akinto Titilayo is giving us an update to her question. She just confirmed that the child vomits only other meals, not pap and milk. I think the child takes pap and milk, but vomits other meals.
Okay, vomits other things. Okay, that's fine. Okay, at least it's good that there is one thing at least that the child is taking. Okay, so like I also said to the other mom, you may just want to vary the way you prepare the other meals, especially if you're starting to introduce it to the child. And don't force the child, kind of like if you're introducing a new meal to a child, just give little at a time. You could just give like 3 spoons for now and see how the child takes it. Tomorrow you can give 4 spoons and then gradually increase it. Don't force the child to finish a bowl of rice or yam or whatever it is that you're introducing the first time. So you may just want to take it gradually, and then augment with whatever the child really likes. But just start with little at a time. But since the child is taking pap and milk, then just continue that. It's already healthy. You can make it healthy, and then continue doing what I said, introducing other meals a little at a time to the child and see how he takes it.
Right. Thank you so much, Dr. Tochi. Just an addition, Akinto, if you're a member of the Facebook group, so please go on. I can see you are because you're on the Watch Party. So go to the guide section and you would go through the a course on complementary feeding, and then you see questions, answers on how to help your child eat. So with what Dr. Tochi has said and what you will get from the
Okay.
group, we think that you'll be fine at the end of the day. So she also asked another question. She says, a child's eyes at birth. Okay, can red eyes at birth cause cataracts for a year-old child?
Can red eyes at birth? Okay.
Red eyes
So
at birth.
well, not likely. Not likely, because I think these are two different things, you know. So if you think that your child at 1 year has cataracts, or you are given that diagnosis, please come and follow up with your ophthalmologist. Or it may not really be related to the red eyes at birth. There are different things that can cause red eyes at birth, you know, especially if the child was, I mean, the mother was infected, you know, some organisms, and then when the child is coming out of the birth canal, may grab some things and then can cause some eye infection at birth, you know, but it not necessarily cause cataract at 1 year. But if your child at 1 year has cataract, you need to see your ophthalmologist. And I want to believe that it's a doctor that told you your child has cataract at 1 year. Just follow up with your doctor.
Okay, thank you, Dr. Tochi. Onyechi is asking, good evening, doctor. Can a breastfeeding mom get pregnant even when she has not started menstruating?
Okay, so good evening, Onyechi. Actually, yes, the answer to your question is yes. A woman can get pregnant while she's breastfeeding. You know, if we say exclusive breastfeeding, it's a form of family planning, it's 100%. So the thing is that while you're breastfeeding, you're not suppressing your menses, and then it's possible that if you're having unprotected sexual intercourse within that period, you know, and then the months when you now ovulate for your menses to come out, you had sex, and you now taking immediately. So from breastfeeding mom you become second missionary journey mom. So it's very, very possible. Yes.
Exactly. Thank you. Thank you, Dr. Tochi. Onyechi, you just heard that, and then please note that. Okpaluwa is asking, good evening. Please, my baby of 6 months has a red eye, and pus is coming out of it, and also have cough and catarrh. Went to the hospital, was given antibiotics and vitamin C to be taken for 7 days. After using it for 7 days, the eyes are not clear yet. What can I do?
Okay, so he was given antibiotics because I had wanted to mention going to the hospital because of the pus. So if the eyes aren't there yet, how is the pus? Is the pus still coming out or not? So if the pus has cleared, it means that the infection likely would have cleared. So you may just need to give time for the eyes to clear. And then is this eye itching? Was he given any anti-drug, or maybe it wasn't itching? But just give time, since you probably just finished the antibiotics and vitamin C. Just give time for the eyes to clear, especially if the pus has cleared. But if the pus has not cleared, you may need to go for follow-up. Let's just be sure that you were giving the reading.
Right treatment. Okay, thank you so much, Dr. Tochi. Akinto is saying, thanks, doctors. God bless you for us. Amen. Christiana is asking, please, can a new mom take drinks like mineral? I mean, she means soft drinks. Can new moms take soft drinks?
A new mom can. Yes, you can. You can, but you know everything is in moderation. Don't sit down and start taking anything you feel like. After now, you start looking for how to lose it. It's easier to gain that weight than to lose it. So there is nothing wrong with a new mom or any in soft drinks like any other person. It's just the health implications and all that. But concerning being a new mom, there is nothing wrong with it. But just take everything in moderation.
Okay, so please ask your questions. I think we've exhausted the questions we have on the watch party and on the live video. So we still have a couple of people watching us. So if you have questions, ask your questions now. A reminder, Dr. Tochi is a general practitioner, so she's ready to take your questions, the questions about your children, about your parents or any member of the family at that. So that's why we are here today. Just also a reminder, this is ATP Live. It's a program that is brought to you by Ask the Pediatricians Foundation. And we do this every Monday at 6 p.m., 6 to 7 p.m. So if you're here, you're not on our Facebook group, you can please join our Facebook group, Ask the Pediatricians on Facebook and Ask the Physicians Family. So we have two Facebook groups, one where you ask questions about your child's health, and the other Facebook group where we got Dr. Tochi from. Dr. Tochi is actually one of our medical professionals on the ATP family group. Okay, so you can search us on Facebook and join us, follow us on all our social media handles on Twitter, on LinkedIn, on Instagram, and you'll find us there. We're there to respond to all of your child health questions. If you want to meet with any of our doctors physically or online, one-on-one consultation, we have the ATP clinics. So if you just go on the group, you use the search button for clinics, you'll be able to find us there. If you want our pediatricians or our professionals, our experts, specialists to attend to you personally, that's a service that we offer. Every other service we do on the Facebook is free. You can ask your questions anytime for 6 days in a week. We are all there. So let's continue with the questions we have. Okay, I think Akbalua is giving us an update. She says the pus has cleared. Okay, but that the child still has the cough and the catarrh. Those ones are still there.
Okay. So the antibiotics has probably taken care of the pus, but not the cough and catarrh. So I think because of the cough and catarrh, you should still need to go for follow-up. Just go for review.
Okay, so Apollo, I got that. Christina is asking, how can I burn belly fat after a CS?
Okay, so because you did CS, you may just need to give some time. Don't just start strenuous exercises immediately. But what you need to do is healthy eating practices. Avoid carbonated drinks. If you can possibly just restrict your drinks to water and fresh juices, that will make a lot of difference. And then by the time you're like 3-4 months into your CS, you can just start doing little workouts, but don't do things strenuous. And just know that it may take time, but consistency is key. Just be consistent. Don't eat large portions at a time. Reduce your portions, avoid carbonated drinks, and then just eat healthy and give it time.
Right. Okay. So on the watch party on the ATP family group, we have a question from Chinelo. She says, good evening, doctor. I noticed that my baby of 6 months is not making enough urine of recent. Please, is this something I should worry about?
Okay, so you may also need to have the child's take. Especially the weather is dry or hot. Is the child taking enough fluids like before? Is the child taking water or breast milk? 6 months should have started taking. At 6 months, you can introduce water and family food. So, is the child taking water well? Is the child taking fluid well? Did you recently change diaper? Because I noticed that there are some people that, there are some diapers that are something like extra dry, something like that. And they soak, they absorb urine so well that you may think your child is not even making urine. You understand? So if that is the case, you may need to observe that. If not, just be sure that the child is taking in enough. If you observe that, yes, this child is getting in enough, but the output is not enough, you need to take the child to the hospital. Especially if there are other things like the child having fever, is the child dull, is the child still playful like before, and all that.
Right. Thank you so much, Dr. Toji, for that. Okay. Again, we've exhausted our questions on all platforms, on the watch parties, on both groups, and even on the live video. So maybe we should go back to the question I was asking. Is there anything that you need to tell us based on your experience in the last 1 month or 1 week that you think you want to correct, you want to help the average parent who is on this call? Please share with us, Dr. Tochi.
Okay. So I think most of the questions we get are related to nursing moms and what to do, what not to do, and of myths going out there. So, well, what I would just want to advise us as a nursing mom, pregnancy itself, it took 9 months for you to get pregnant. It's a journey. It's a journey, you know. And then when you've put to bed, just give your body time to come back to shape. Don't especially don't compare yourself with others, and don't be under pressure. Don't be under pressure. Just give your body time. And then that initial, especially the weeks immediately following childbirth, be very, very careful and cautious what you're eating, because that's the period when we gain all the weight, and then later we now say, what have we done? Let's start losing this weight. So if you can avoid gaining those weights in the first place by watching what you eat, don't just say, I'm not see more than passes you, just be eating and eating and eating. Even when your body is saying I'm full, you're still eating. So those initial weeks immediately following delivery, be cautious, be very, very intentional kind of what you don't starve because your baby needs food. The baby you need your breast milk to be flowing and all that. Don't starve. So just eat healthy. Don't eat for two, kind of eat healthy, take lots of fluid, let your breast flow well, and then I don't think you have a problem losing your weight later.
Okay, Dr. Tochi, I just saw a question about the pain in the anus of an adult. What causes it and how can it be treated?
Okay, so there are various causes. We want to know if this pain is always there or is just when the person wants to pull. We want to know the consistency of this person's poo. Does the person strain to poo? Is the person constipated? So we want to know that. You may want to soften your stool. You may want to take warm water, especially if you're constipated for long. You want to take warm water first thing in the morning, usually helps, and then increase your fluid intake, take raw veggies, take lots of fruits, and make your poo soft. And then if the pain is not related to pooing, like you just have that constant pain in your anus, not related to pooing, you may need to see your doctor.
Right, thank you,
Other
doctor. Hello, doctor.
investigations.
Please, I want to know if a sticky sperm is healthy because it's hardly felt when being. Is a sticky sperm healthy?
It's hardly felt when what?
When it is released. I don't know what that
Okay,
means.
okay. So yeah, that's okay. So you can't really say by just looking at the pen whether because it's sticky or not, whether it's healthy or not. So what you can use to know definitively if this pen is healthy, as you put it, is to do a semen analysis. So when you do a semen analysis, you'll be able to the analysis will tell us the sperm count, tell us the quality of the sperm, are they motile, how do they move and all that. So it's a semen analysis that will tell you definitively if that sperm is sticky or not, is healthy or not necessarily whether it's sticky or not sticky.
Okay, so Augustina is asking, my baby has jaundice at birth. Hope nothing to worry about because I'm seeing questions about jaundice since I'm kind of worried now.
Okay, so we don't know how old your baby is, so like you've been seeing and hearing us talk about jaundice. Jaundice at birth is can be uh, like it can be as a result of a lot of factors, like we've already said, and the treatment also varies according to. You don't know how old your baby is. If your baby had jaundice at birth and was appropriately treated, then there's nothing to worry about. And there are some jaundice that may not necessarily require treatment. If the level is not so high, it may not require treatment and the child is fine. So it all depends on your baby and the treatment the child got, if you needed one, and how old your child is and what milestone the child has at the moment.
Okay, thank you. We're doing a lot of jaundice today, and I can imagine why she had to ask that question. So many people have talked about jaundice today.
She'll be scared,
Yes,
yes.
I think she has updated. She says her baby is 5 months now.
Okay, so at 5 months, so you just want to know what is your child okay? Like, what is he holding up his neck? Is he attempting to sit? If your child developmental milestones are in order, then there is no need to worry.
Okay, so Augustina, I'll just suggest you to go on our Facebook group and read the article on developmental milestones, so you can actually see for yourself
Neonatal
what your
jaundice,
child is
yes.
able to do. Now we have loads of resources on the Facebook group. So if you just go to the topic, you will see everything we've talked about jaundice. You could take time to read. You also see things we talked about development and all that. So we have loads of resources on the Facebook group. So do use the topic to search, and I'm sure that your worries will your worries will be allayed. So that's what we are about, really. Okay, so Adesua Kingsley is asking on the watch party. She says, "Good evening, doctors. My 4-month-old baby stopped sucking from the breast. They would just be licking the nipple. I gave birth to him at 32 weeks plus, and I expressed milk. And I also do NAN 1. Is there any cause to worry?"
Okay. Okay, so the child is not okay. I want to believe that since you said stopped, it means that at a point the child used to suckle, and then after some time the child stopped suckling. Okay, you may want to be sure that your posture and that the child is latching properly. At 4 months, the child should still be sucking. She still have that suckling reflex. So you need to. I think I would advise you watch some videos on the Facebook group. Just be sure you're doing all you should be doing right. Like the child is latching on properly, doing all you should be doing right. And if the child has stopped sucking, maybe you should actually see your pediatrician to just be sure there is nothing else. Because at 4 months, the suckling reflex should still be there.
Right. Okay, so Augustina just told us that the child is very smart.
Especially since the child was preterm. So don't worry, Augustina.
Okay, I think we may be able to take one or two questions, and we have just 3 minutes to the end of the show. Olani Bakun is saying, "Thank you, Ma. Please, why should a breastfeeding mom purge almost frequently? And what could be done that won't affect the child?"
Okay.
Olani
So the
Bakun,
breastfeeding
okay.
should watch what she's eating. You wanted to add something?
I was wondering if you got the question right, because it looks like there's a bit of a typo on it, but maybe you were able to infer what she's asking.
Okay, I just want okay, I think I did. So I would say a breastfeeding mom should watch what she's eating. It's what will purge the any other person could purge her. So just be careful of what you're eating, and make sure that what you're losing, you're replenishing it so that your child also doesn't get dehydrated.
Okay. So Mide Sheun is asking, my belly fat has refused to go down after a month of normal delivery. What can I do? So it looks like
Wow,
today
just
has been
one
about belly
month.
fat
Something
and
that
jaundice.
carried the someone that carried a human being wanted to go down in 1 month. No, now that's too soon. That's too soon. So just give it time. Be very, very patient. Like I've said before, be careful of what you eat. Portion control, vary your diet, include fruits and vegetables. And since you had vaginal delivery, you can start little workouts, nothing too strenuous, just workouts. You can watch some videos on YouTube. There are some walking videos, like exercises that are walking, but you're burning fat. But 1 month is too soon to notice any appreciable change. 1 month is too soon. Just be patient and be consistent with what you do.
Okay. Thank you so much, Dr. Tochi. We've had a very lovely time with you. And we can only but say thank you for coming to share from your wealth of experience with us, for answering all our questions. We do appreciate you. And we hope that we'll be having you more on the
Thank
ATP
you.
Live video, on the ATP Live show. Yes, we hope to have you more. So, ladies and gentlemen, thank you so much for joining us. It's been an amazing time with Dr. Tochi in the house, and I'm sure that you've learned something. And if you missed out on anything, please, you can watch this video again, because we'll have the video on the Facebook group and even on YouTube. So anytime you want to, you can come back to the video to watch. And we'll be ending this broadcast on this note, and want to say thank you to Dr. Gbemisola Boyede for giving us the opportunity to do this. And that's the founder and the CEO of Ask the Pediatricians Foundation. We've been doing this for over 4 years, and it's been very impactful. So every Monday, we used sometimes on Saturdays and sometimes, but in the last 3 months, or since the year 2021, we began to host our ATP Live programs on Mondays at 6 p.m. Usually we have this on Facebook, on YouTube, and on Instagram. But for today, we're just on Facebook and YouTube. So if you're just joining us, this is Ask the Pediatricians Live. You could watch this video again for questions and answers that have been posed to our doctor, Dr. Tochi. Dr. Tochi, thank you once again for joining us. Thank you, everybody, for joining us. See you again next week, same time. Bye-bye.
Thank you to Dr. Vera. Thank you to all the moms that participated. Thank you, everyone. Bye.